Hello and welcome back. We are going to get started as I put my eyeball or my thumb right in the eyeball here. I'm going to start this video is going to go over the muscles of the head and neck. So I'm going to have a muscle list right here next to me, and I'm going to show you where these things are on our model. Now, we may not have introduced you to this wonderful creature here. This is Buzz. So Buzz is our full body model that we have in the anatomy labs. We only have one of Buzz though, so we'll try to make him shared between the two neighboring classrooms during our muscle lab time. But again, use this video as a substitute for when you can't actually get your hands on the physical model. So I'm probably going to let go of Buzz's head because his brains keep wanting to fall out. So I'll take the brains out. See? Sometimes we feel like that, like our brains are gonna fall out of our skulls, right? That's A&P for you. Okay. So I'm going to start at the very top of the list and just work my way down the list, and that will be our first video of the muscles from your muscle list. So if we take a look at the first muscle, it has kind of a long name. It's called epicranius frontal belly. In some of the older editions, it's called the frontalis, and I am totally fine with you guys using the word frontalis for this muscle right here. So this is the frontal belly of the epicranius, or frontalis is totally fine. So the origin is listed as the epicranial aponeuroses, which is this big gray tendon. And aponeuroses is a big flat tendon, not like a bandy tendon. See, there's his head. So this would be more like a band of a tendon. The aponeuroses is the big sheet of tendon right here. So the origin is right here. The insertion is at the skin of the eyebrows, okay? So imagine you have a muscle that originates here and inserts here. So imagine there's skin on his face. So if this is the origin, this is the more stable of those two attachment points. So when it contracts, it's not so much going to bring your scalp down towards your eyebrows, but it's going to bring your eyebrows up towards your scalp. And so this would be like the action of raising your eyebrows and wrinkling your forehead. So this is your frontalis. When you're in surprise, you're like, huh? What? That's your frontalis, raising your eyebrows in surprise, right? Okay, so that's our first muscle down. Not too bad. The next muscle, I'm going to take the cap off because we aren't going to need that for a while. The next muscle is called the Orbicularis Oculi. It's this big circular muscle right here. It goes around like an orbit, Orbicularis Oculi, because it's going around the eyeball. This originates on the medial margin of the orbit. So here's your orbit, is your eye socket basically. So medial margin is going to be towards the midline. And then it inserts on the skin around the eyelid. So again, there's not any skin on this model, but you can imagine this. So it's like a sphincter muscle that when it contracts, it's going to close the eye, right? So that's your orbicularis oris, blinks or closes the eye. The next one is kind of a pair of muscles, but we're just going to have you learn them together, is your zygomaticus, major and minor. So these two muscles here. If you remember, your zygomatic bone is your cheekbone. So this is the origin of the zygomaticus. And then the insertion is your corner of your mouth, right here. So if you have, again, a muscle attached to a bone and then attached to the flexible part of your corner of your mouth, when this contracts, it's going to raise up and elevate the corner of your mouth, like in smiling, right? So it's your big smiling muscle. So smile right now. There you go. And that is going to be your zygomaticus muscles pulling the corner of your mouth towards your zygomatic bone, zygomaticus. All right, the next one is your orbicularis oris. It's another orbicute, like an orbit. So this was Orbicularis Oculi, Orbicularis oris. So it originates on your maxilla and mandible, okay? And then it inserts on some of the smaller muscles and skin around your mouth, and it closes and purses the lips. So imagine like a kissing shape of your mouth. So again, it's like a sphincter muscle. It's going to close and purse up around your mouth, closes your lips. Okay. The next one on the list is called the buccinator. So I'm going to get my little pointer here, is this pencil. So the buccinator is this muscle right here. The fibers run horizontally like this. Okay, it's a little bit deep, so it sits underneath your zygomaticus muscles. So the buccinator originates back here on the molar regions of your mandible and maxilla, kind of like back behind this muscle here. And then it inserts on your orbicularis oris. So it comes in and blends in with the muscle fibers of this muscle here. Its job is to tighten up your cheeks. So it's called the buccinator. Sometimes I've heard it called the buccinator. But the buccinator, remember the bucca is the cheek region. So it kind of tightens the walls of your cheek as if like you're whistling, or if you play an instrument like the trumpet, you would hold your buccinator tight while you blew on the trumpet. Okay. The next muscle is this one right here. It's numbered 14 on the model. This guy right here, this is called the masseter. The masseter is the major muscle of mastication, which is chewing. So that name kind of gives you a clue as to what it does. The masseter originates on that zygomatic arch, right? So your zygomatic bone and your temporal bone create that arch. And it inserts on the mandibular ramus and angle. So remember, here's your mandible. So here was our angle, and the ramus kind of goes up, going up towards the temporal bone. So here's your muscle. It originates here, inserts here. So you can imagine when that muscle contracts, the insertion is going to move towards the origin, and it helps to close the jaw. So the masseter closes the jaw, and it's your primary muscle of eating, or mastication, chewing, I should say. The next muscle I got to flip Buzz over, and I will put his skull cap back on, because this is the temporalis, this big muscle here. And it's kind of nice because it sits right on the temporal region of the skull, which we can bring back from our bone list. So the temporalis originates on the temporal bone, which is kind of right in here, and it inserts on the cornoid process of the mandible. So you guys remember your mandibular structure, right? So angle, ramus, mandibular foramen, cornoid process, not foramen, mandibular process. So here we have our cornoid process. So the temporalis originates on the temporal bone, inserts on the cornoid process of the mandible, and it elevates and closes the jaw. Okay, elevates the mandible, closes the jaw. So the temporalis and the masseter work together in closing the jaw. Now I'm going both sides, but know that you're going to be symmetrical. You're going to have a masseter and a temporalis on both sides. It's just one side of Buzz shows deep muscles, and one side of Buzz shows more superficial muscles. So that's kind of the organization of this particular model. The next muscle on your list is called the platysma, and we don't have a platysma on Buzz. You'll have to see the platysma on a picture, but imagine these big flat kind of muscles here going from your underneath your jaw line down to the fascia of your chest, like right above your sternum and your clavicle. The platysma, so it originates on the fascia of the chest and the neck, so it's going to be down here, and then it comes up and inserts on the mandible and the skin of the cheek and the mouth, and it helps to tense the neck. So I always think of it when I contract my platysma, it makes me talk like who's the guy on Gilligan's Island? Mr. Howell III, right? So you tighten up your neck and you have those big bands of tissue, and that is your platysma, and it tenses the neck, and it helps to depress or lower your jaw. And it also helps assist in frowning because it pulls down some of that skin, right? That was our platysma. Can't see on the model, but you can see it on your pictures and your diagrams in your books. The next muscle is called the sternocleidomastoid. So the sternocleidomastoid, big name, but the name gives you clues as to its insertion and origins. So the sternum, remember the sternum is going to be this breastplate right here, and the clavicle goes from your sternum to your shoulder. So it originates on your sternum and clavicle. So that's the sternocleido part of the name of the muscle. It's this combination muscle here. And then it comes up and it inserts on the mastoid process of your temporal bone. So right behind the ear. So this is called the sternocleidomastoid. And its action is to flex and rotate the head. So it kind of bends the head down at an angle on either side. So you're going to have a sternocleidomastoid over here, and you'll have a sternocleidomastoid over here. Okay. The next one, we kind of have to look under the chin here of Buzz. So these are called, or this one muscle is called the digastric, but it has two parts to it. So I don't know if you can see, I'll see if I can lift it up here. We have these two band-like muscles right here and right here. This one, kind of more posterior, comes down from the, digastric, and inserts mastoid process, so kind of back by the sternocleidomastoid. So it has a couple origination point. So this one's a unique one. So it originates on the mandible and the mastoid process of the temporal bone, and then it comes and turns a corner and inserts on the mandible, originates on the mandible. I'll get this. So mandible and mastoid process are two origins, and it inserts because it loops through a little hoop of ligament on the hyoid bone. So the hyoid bone is the insertion. So when this muscle contracts, this is the posterior belly and the anterior belly, it helps to pull in both directions, kind of back this way, and that's going to elevate the hyoid. Pulls down on the mandible a little bit, and it brings up the hyoid bone. So this is your digastric, kind of two parts to it, this one and this one. And then right next to that, we have this another little strippy-like muscle here called the stylohyoid. It originates on the styloid process and inserts on the hyoid bone. And its job also is to elevate the hyoid. Remember, the hyoid is that kind of horseshoe-shaped bone from the neck, from our bone list. We have quite a few hyoid muscles here. So we have digastric, stylohyoid. Then we have this one here, number 28. You can see the fibers are going in perpendicular to that digastric. So this is called the mylohyoid. It originates on the medial surface of the mandible, kind of this inner surface, and it inserts on the hyoid. And its job is to elevate the hyoid and the base of the tongue. So it's kind of, when you try to lift up the tongue, you can feel the muscles underneath your jaw kind of tense. That's one of those that does that. Okay. All right, and then we have our sternocleido. So again, we got to remember our sternum is going to be sitting right here. And this is going to go from the sternum all the way up to the hyoid. So it's this long strap-like muscle here. So from the sternum to the hyoid, so this is the origin, this is the insertion, and it depresses the hyoid bone, so it means it brings it down, and it also helps to lower the larynx. The larynx is your voice box right here. Then we have another sterno. This, all we're seeing is a tiny little bit of it. So it sits underneath the sternocleido. This is called the sternothyroid. It goes from the sternum to the thyroid cartilage. So it's a short little muscle here. So it originates on the sternum, inserts on the thyroid cartilage, and it helps to also bring down the larynx and the hyoid bone because these are connected with another muscle that's not on your list. Okay. And then our last collection of muscles for our head and neck area are these three muscles here. These are collectively called the scalenes, not this one, so ignore that one. We have an anterior, middle, and a posterior scalene. You just need to know them collectively as scalenes. Now, on our model, the picture doesn't show their insertion and origin points as accurately as some of the pictures in your text with some of the other muscles removed, but for the best we know of our model, these are our scalenes. They originate on the transverse process of your cervical vertebrae. So imagine these are kind of going deep. They're kind of coming back down towards the spine more. And it inserts, so cervical vertebrae is up here, and then it's going to insert on the ribs 1 and 2. So the upper part of ribs 1 and 2. And when this contracts, it can pull up those ribs a little bit, and it also can flex the neck. So it's almost doing a little bit of both. So the origin is moving towards the insertion. Insertions are moving towards the origin. So these are your scalenes, these three here. All right. So that wraps up our buzz head. So the muscles of the head and neck. I will see you next for the muscles of the shoulder and anterior thorax. Bye.